During the session on newborn screening and carrier screening, Dr. Angus Clark presented very interesting data about the Duchenne Muscular Dystrophy newborn screening in the whales. Uh, we need to figure out that Duchenne Muscular Dystrophy newborn screening is coming back at the front screen because there was two papers recently published, one from Taiwan and the other from the US, on two pilots with new drugs reaching patients' bedside like vamorolone or givinostat. It makes more and more sense to consider early detection of newborn screening, and of course, gene therapy could become an additional rationale to screen these patients. What happens from this trial in Wales is that the buy-in by the mothers at the time at which we had no treatment was huge. It was like 92% of mothers who agreed for the baby to be screened for Duchenne muscular dystrophy. Also, at that time, there was no treatment to be proposed to the child if he was identified with Duchenne muscular dystrophy. So a very high buy-in at the time, and a process that, of course, identified patients by elevated CK, and at that time the need to reconvene with the patients for a second sampling, which is of course burdensome because, as you might imagine, if CK are elevated in 1 out of 100 patients, it means that we need to see again about 1 out of 100 patients, a baby who is born in an area, which is quite a lot. Nevertheless, this program has been shown to efficiently detect Duchenne muscular dystrophy at a time when there was no significant treatment or intervention to be conducted at an early stage. Now in 2022, things are changing, and progressively, Duchenne muscular dystrophy could be considered more and more for newborn screening pilots.
Part of this discussion also led to reflection on the role of newborn screening in Duchenne muscular dystrophy. It's very clear that there have been pilots in multiple areas around the world, but nowhere are people routinely screening for Duchenne muscular dystrophy in the newborn period. And part of the reason is that it has taken some time to have effective therapies, and in particular, effective therapies that people are willing to broach in young infants and newborns, because that's part of the ethical consideration for initiating a newborn screening program, is that you have both treatments available as well as outcome measures that will help monitor and document and confirm impact of any of the efficacy of any interventions. Conversations with a number of the individuals there reminded me that there's a number of different approaches that have been already put in place. One of the things that has been done and is continuing to be studied is the impact of anti-inflammatory treatment, specifically corticosteroids, on young infants and children with Duchenne muscular dystrophy. There's been one published study looking at the impact of oral prednisolone given 2 consecutive days per week in young boys under 30 months with Duchenne. And while this was a small pilot study over 6 centers, it was very clear that the motor progress in these first 30 months of life, even though 30 months of age is well below the usual age of diagnosis of Duchenne muscular dystrophy, if you look very carefully at the boys with Duchenne and compare them with typically developing young boys who do not have Duchenne, you can see a difference in their motor milestones over these very early years, and the institution of this oral corticosteroid therapy moderated and virtually eliminated that difference.